Well, good afternoon or good morning, everybody. It is Wednesday, September 6th. It's 10 o'clock in the morning, and you've joined us for the Los Angeles County DRC update specific for long-term care. My name is Jason Beldman. I'm the Director of Emergency Preparedness for the California Association of Health Facilities. And we do these quarterly webinars to kind of collect information from the DRC meetings throughout the county over the course of the last few months. And then we try to create kind of an updates that's specific to long-term care. So a lot of times if you go to the DRC meeting, much of what they're going to discuss is for acute care hospital preparedness, although it does include obviously everything for everybody in the coalition, not just long-term care. We just try to, well, one, we send a representative to those meetings to represent long-term care, but also to share this information with facilities that show up at the meetings or participate virtually. And then we take that information that is most appropriate for skilled nursing facilities and intermediate care facilities. So I want to thank you for joining us. As always, these webinars are recorded, and that way, if for some reason you miss a portion of it and you need to go back and watch it, these will be posted on the CAF YouTube page, and I'll have a link for where that is located later on in the presentation. But with that being said, let's get started. If I can get the slides to move. Okay, there we go. Oh, that's me. And those are the folks that we have working with our program. And one is, and I would mess up BK's name, but BK is the disaster program manager overseeing long-term care and our sector of the healthcare component for Los Angeles County EMS agency. And then we have a disaster program coordinator named Mary Story, who works in administrative capacity for our program. And we also have Tamiza Teja, and Tamiza's wasn't able to make the webinar today, but she'll be on the webinar next time. Tamiza is the representative that represents CAF at the DRC meetings, and she speaks about issues specific to long-term care. And many of you may have or may remember Tamiza because we had a grant for many years where she would go out and do individual site reviews of emergency operations plans. And I believe she's still available to do that. We just don't no longer have a grant to pay for that. So if you're interested in it, you certainly can reach out to me or Mary, and we can connect you with Tamiza. It was a great program. And even more so than that, Tamiza helped develop a checklist that you can utilize to kind of do a self-assessment on your preparedness, at least from your written plan perspective. And so, so much of what CMS, the surveyors come out and look at is the written plan. And so if you're concerned about whether your written plan is appropriate or you've not had a review of that in a while, I know we haven't got a ton of emergency preparedness surveys through the pandemic. We anticipate that's going to really ramp up, going forward. But if it's been a while since you've taken a look at your plan, it might be good to download the checklist that we have available on our website, and that way you can do a self-assessment to see if your written plans are kind of up to snuff and you think they'll pass survey, as well as being actionable in an actual disaster, and that's important. So we'd want to make sure that the phone numbers and contact and all that information is appropriate and accurate and still available to us. All right, so today, we'll discuss the DRC updates, CMS and state updates, so any kind of federal or state updates that we've come up with. And then I want to talk a little bit about the Mercy exercise. This is one of, one of the only functional community-based exercises that I'm aware of that you guys have the availability to participate in it. Actually, we really encourage everybody to participate in the Mercy exercise. But in terms of checking off that regulatory requirement for exercises, the functional exercise that Los Angeles County is doing in November will be your opportunity to check off that regulatory box for 2023 calendar year. And then I'll talk about there's kind of a pre-exercise webinar where we talk about what does it look like to actually exercise. And then we'll talk about the exercise itself. And then we'll review upcoming trainings and or other webinars that were either recorded or they're coming up, all as it relates to disaster preparedness or emergency preparedness and things like that. All right, so we use a ton of acronyms in emergency management, and it gets a little confusing at times. So if I say something, and I may refer to any one of these things, I've already referred to the DRC, and if you're not familiar with what that means, that's the Disaster Resource Center. And I'm going to show you contact information for each one of these folks in a second. So we use a lot of these acronyms, just so you know, like the MAC, the Medical Alert Center in Los Angeles County, that's specific to LA County. And that's really important because that's something we will utilize, or that the Medical Alert Center will be activated during that Mercy exercise that we talk about later. And we'll talk about the role that they play in facilitating, patient movement and access to resources during disasters. So really important stuff that you know what the MAC is and what its function plays for you in the county. And then NICS, Nursing Home Incident Command System, and I'll talk about an upcoming training next month for that as well. All right, so we have approximately 400 SNFs. I think it's somewhere in the neighborhood of 383 now, give or take, but that shows this is a map view of a wide disbursement of different long-term care facilities across the county. And what we have done is we've mapped out the SNFs in relation to the disaster resource centers. So you can see on this map, the disaster resource centers are acute care hospitals that are essentially act as a hub for the Los Angeles County EMS agency, so that during disasters, resources and supplies are staged in these areas. Because the county is so large, it would be virtually impossible to have one central location for the disbursement of resources during a disaster. So in Los Angeles County, they've divided that up, and they've given a portion of that responsibility to these hub hospitals. These hub hospitals also act as kind of the hub for coalition activities. So they have the Disaster Resource Center meetings, which we encourage you to attend. If you're going to pick and choose which one of the Disaster Resource Center meetings that you do attend, there are two that I would suggest. One is in the lead up to doing your hazard vulnerability assessment. This is an annual requirement that every facility in the state and in the nation has to do. In Los Angeles County, what we do is each one of the disaster resource centers takes the group of healthcare facilities that are in their geographic area, and they build a coalition HVA or something that's for their specific area. And this is what you're going to need to provide to the surveyors that says you help contribute to the community-based HVA. So you're going to do the HVA for your individual facility, share that with the DRC, and the DRC is then going to turn around and give you a completed HVA that shows all of the facilities built into this HVA. The HVA, that stands for Hazard Vulnerability Assessment. So that's just a view of what risks are most likely to occur in your geographic area and for your type of facility. So that meeting is specific to HVAs, and you need to get that document from them in order to be compliant with the CMS rule, and you need to do that annually. So that's an annual requirement to get that. So that's the one meeting from DRCs that I would say definitely you have to go to. And then the lead up to any exercises. So many of the DRCs will do a tabletop exercise that will help you prepare for the functional exercise that comes later in the year. And so that way you can talk through some of the issues and get an idea of what the exercise would actually look like when you're practicing it at your facility. So those two, if you're going to carve out 2 meetings to go to. I would encourage, obviously, go to as many as you can. But if you had to pick 2, those are the 2 definitely the most important ones. And they're the ones that you absolutely will need information from that meeting in order to support your regulatory compliance. So hopefully I made that clear and why you should be integrating with the disaster resource centers. If you're interested in, oh gosh, okay, now I know I have to at least go to a couple of these meetings. How do I get connected with where the meetings are and when they will be held? And so if you take a look at that map and you see which ones are closest to you, and I guess I should mention this before we go further. In the handout section, there's a copy of these slides as well as some other things, and I'll go over the handouts in a little bit here, but just so you know that you have this map, as well as all this contact information for all of these folks for each one of the DRCs. And if you contact these folks by email and you just ask to be put on their listserv, if you want to CC me at the same time, you certainly can. And that way we can kind of track if folks are getting back to you and things like that. But in any case, find the DRC closest to you, email the DRC coordinator and ask the coordinator to be put on their listserv for the DRC meetings. And you should get notification of when the meetings are. You can add them to your calendar. All of the acute care hospitals are required to attend in person. All of the other folks in the healthcare spectrum, so the other 16 provider types, whether it be us as skilled nursing facilities or hospice or dialysis, those folks can all participate virtually. So they'll give kind of a hybrid availability for the meeting. So you'll get the opportunity to kind of choose those. I really encourage, at least once a year or twice a year to go shake hands, press the flesh, get to know people at the DRC. Because really, in a disaster, these are the folks which you may be most reliant on in a disaster. And these are the folks in your general geographic area that would be most available to assist you. Hopefully, if we could get enough people to come, it would be great. You can meet other long-term care facilities and talk to them about signing mutual aid agreements or transfer agreements if you don't already have things like that. So, we really encourage participation in these meetings for a multitude of different reasons. So anyways, these are the contact information for these folks. All right, and so as a result, kind of what changed with the DRCs during the pandemic was we didn't get a lot of updates from the acute communicable disease unit over at public health. But now at the DRC meetings, public health, meaning local public health, Los Angeles County Department of Public Health, has been participating in the DRCs, and they've been giving updates pretty consistently on different transpirings with the pandemic and as we go forward. Now, traditionally, I wouldn't necessarily call this an emergency, something we would talk about in these meetings, but I thought it important because anytime you get an outbreak, in my estimation, especially if it's more than one, if we're talking about a multitude of folks, you should be kind of activating your emergency operations plan concurrently with that outbreak. And especially if you've got staffing built into your EOP where you talk about, how are you going to deal with the loss of staffing and things like this. I think it's important that we kind of view these things in terms of this could be potential activation of our EOP. So with that being said, how do we kind of minimize that? And this was an announcement that Dr. Nie from LA County sent over to me, and she wanted me to pass this along. They are anticipating increased COVID transmission as well as other things. So they wanted us to really start preparing right now for seasonal vaccination, even a little bit earlier than we would normally do. And so their recommendation there on the bottom is skilled nursing facilities should order vaccine from their LTC pharmacy partners now so that they may begin administering and provide important protection before the beginning of the season this fall. So that being said, that's just like an update, I have not seen specifically data on how many new cases we're getting, but I definitely know there has been an uptick in both the acute settings and in long-term care settings, not just in our county, but across the state as well. All right, so the next update I wanted to give, once again, this is not necessarily something that falls under the emergency or disaster, but I think if we're activating our EOP during an outbreak, we need to kind of factor in some of these things. And this last part was really concerning to me, because this is something that we quite often do in our facilities, and I don't think that the information has got out, or it's as well known. And so in the handouts, one of the handouts I included was a set of slides that the Occupational Health Branch from California Department of Public Health put out last month or a couple weeks ago. And it had to do with best practices for ventilation. And so if you think about Cal OSHA has a specific requirement for us to protect our employees. It doesn't have anything to do with patient care. It only has to do with staff safety or you know, so those things are kind of prescribed for us. And so with Cal OSHA, they have defined COVID-19 as an airborne infectious disease, or an AID. And when they define that as an airborne infectious disease, it requires us to do specific things in our setting. Now, I want you to go through those slides so that you kind of understand what the recommendations are there. But this one part is really important, because this can, I don't think a lot of people have PAPRs. And if you're not familiar with a PAPR, it's a powered air purifying respirator. And it's one of those hood type devices that goes over your entire head. And those devices need to be utilized when we're doing high hazard procedures. And so on anybody with COVID. So let's say you've got somebody with COVID in a room, and let's say, Beth, you've got them in a single room, you know, doing all that you can. The staff that treats that person, if that patient or that resident is undergoing any kind of aerosol generating procedures, think CPAP or BiPAP, something really minimal like that, that is an aerosol generating procedure, and it does require staff treating that patient to be wearing a PAPR during the course of that treatment. And so that is news to a lot of people, but this is a requirement that's been in place since 2009, I think. And it's just that now that the pandemic's over, we have to go back to what the regulations actually call for. It does call for that these procedures be done in an airborne infection isolation room. And I realize most of you do not have airborne infection isolation rooms, and it's unlikely that you will be able to find one to transfer somebody out. You know, the regulations say you should attempt to transfer folks out. I just don't think it's feasible or possible for an acute care hospital to open up their minimal airborne infection isolation rooms for somebody that's not acutely ill. And obviously, if they're acutely ill or they need treatment at the hospital, please send them to the hospital. But for those folks that just have a COVID diagnosis, we're not probably going to be able to find locations for them to be transferred out. So it's important that if you're going to do that, you should probably at least have a few of these in your cache of supplies. I will say the good thing about PAPRs, the really good thing is, and you may have run into this already, but for anybody that has facial hair, PAPRs don't have to be fit tested. So if you have employees with facial hair that didn't want to shave for whatever reason, they could use a PAPR and do work. That's considered a higher level of protection than an N95, and that's why they say N95s are not sufficient for these high hazard procedures. There is an exception, so if an airborne infection isolation room is not available, and the delay of the procedure would be detrimental to the health of the patient, then you can go ahead and treat them in place. So There's a lot more information on those handouts. It's very detailed, and so I was appreciative of the occupational health branch giving us some clarity on that. There are some things that I would have concern about, but one of the discussion points in there is that your whatever temporary strategies you come up with, because we're going to assume you don't have an airborne infection isolation room available, so you're going to have to create a temporary kind of system to deal with that until obviously they're COVID free or have gone through their isolation period. So I would say, it's probably best practice to have portable air cleaners, at least one or two in a sufficient quantity that you could turn 1 or 2 rooms into an airborne infection isolation room, just a temporary one. There's guides on how to set those things up. It's not specific, but it does say that your measures must be, you must be able to demonstrate their effectiveness. And that is a little concerning for me, because it doesn't give like metrics for us to determine the effectiveness. And one would assume that the effectiveness would be determined by the ability to prevent transmission to either staff or other residents. And so, I'm not sure how you're going to accomplish that. I don't even know if it's the use of a portable air cleaner would guarantee that if you're cohorted in a room, would guarantee that the other person in the room would not be at risk. I just don't think they're a cut and dry solution. So it concerns me that there's a ambiguity in what would be considered effective. That being said, that's the best information I have. I do know that definitely for AGPs, you want to make sure you have a PAPR on hand. For the other ones, I think if you can demonstrate your, limiting movement into that room, in terms of work practice controls, you want to make sure everybody obviously is wearing the minimal level of PPE that's required for that case. So if it's just a normal somebody with COVID, obviously the healthcare worker is going to wear an N95 when they're in that room. But yeah, I think as long as you're doing that, you've got your plan for I'm drawing a blank now. Your respiratory protection plan, sorry. So as long as you've got your respiratory protection plan, you can show that, and you can show that you're either changing the airflow direction, taping off one of the return grates, doing something to minimize air that moves from the room out into the hallway, and then turning it, making it move back into the room. And then if you have portable air cleaners, if you can do single rooms, those are the things that you want to kind of highlight and do in terms of your effective measures, quote unquote effective measures. So hopefully that helps you get through it. If you've got questions, I'm happy to answer them. Probably more so than that. I would I'd contact Cal OSHA to get some questions answered, and certainly the folks at Public Health, if you're questioning whether your temporary measures are appropriate, you can certainly give those folks a call, and they'd be happy to go over that with you. So hopefully that that kind of explained all of the Cal OSHA requirements. I know it's quite lengthy, and it can be very confusing to go through the thing. So in any case, hopefully you'll follow those slides. And then if you have questions, just reach out to me or the folks from the occupational health branch, and they'll be happy to help you out. All right, so let's talk about the medical response and surge exercise. It's called the MERCY exercise. That's how we abbreviate it. And this is going to be the functional exercise for the community, for Los Angeles County, for our healthcare spectrum. The exercise date is on November 16th. And so on November 16th at 8 a.m., the exercise will start. I think it may start a little bit earlier for hospitals, but you should begin notification right after 8 o'clock. And when I say you should be getting notification right after 8 o'clock, one, you're going to have to go ahead and sign up that you're going to participate in the exercise. And so you'll get a certificate at the end of all of these components here. You'll get a certificate at the end showing that you participated. So that'll help for regulatory compliance. But more than that, what it will do is will let us know that you will be responding to any kind of service level polls on ReadyNet. And if you don't even know what I just said, that's okay. We want to get folks in the county used to using ReadyNet. ReadyNet is the primary communication system that the county will use in a disaster to communicate with you. So the LA County EMS agency will utilize ReadyNet to both push out notifications, but also seek information from each facility. So when we talk about a service level poll, that goes out to you and just says, how are you doing? What is your status of your facility? And they'll give you, ask for you to say, are you open and available to take admissions? Are you open but closed for admissions? Are you, do you have problems? Do you need assistance? Things like that. And what that does is it gives the county obviously a 30,000 foot view of all of the facilities in the county, and kind of gives them an idea of where help is going to be needed. So it helps during the disaster that we have that information as quickly as possible. So that's why that system is utilized. It's also utilized to do bed polling. So we may send out a bed poll that says, okay, you've identified that you are okay and you could take new admissions. We're going to send you a bed poll, and you tell us how many male, female, how many vents, how many patients you have, and things like that. And so there'll be a few questions about how many available beds and then in what category. Honestly, if you have your admissions person fill that information out or give them access to the ReadyNet sign-in, they should be able to put that information in and like less than a minute, as long as they get the login. So that's what we expect during the disaster. And so that's what we're going to practice during the Mercy exercise. So what's going to happen is on that date, you're going to get that service level poll from ReadyNet. And the expectation is a part of your exercise is going to be that process of responding to ReadyNet and putting in the information that they're asking for. And it can be accurate to what your count is now, or you can simulate whatever you want and make it a part of the exercise. So you could simulate, no, I'm red and a portion of my building is collapsed. Or in this particular exercise, we're going to talk about loss of power. So that would be one. You could say, yes, I'm okay, but I can't take new admissions because I have no commercial power and I'm on emergency power now. So those are kind of things that we're going to expect you guys to participate in. So we do a participant webinar that'll be on September 26th, so about 20 days from now. And that participant webinar will talk through what it looks like to participate in a functional exercise at your facility. Just to give you a little kind of precursor to that, when we talk about a tabletop exercise, those are written exercises where we talk through the actual scenario. In a functional exercise or a full-scale exercise, we're actually doing the work. So if there was let's say in this exercise, there's going to be a power outage and a surge component. So the county is going to want each one of the facilities to say, yes, I can help, or I can offload people from the acute care hospital, so the acute care hospital can take care of the pediatric surge that's happening now. And so you would want to simulate how would you, where would you put the people, and how would you set the beds up? Would you expand past your licensed bed capacity? You don't have to, but if you wanted to, you could. And how would you do that? So it would actually be simulating the work. So you would do the work of taking new patients in. And so let's say you wanted to practice, oh gosh, well, let's take 6 people all at once. That would be a good example of doing that kind of search component within the exercise. And you could say, okay, we're going to simulate 6 or 3 ambulances show up right now with 2 people inside each ambulance, and how are we going to quickly get those folks inside and in rooms, and and what's going to be our process to do the intake of each one of those residents, and how are we going to catalog their medications and get them all squared away. So it's actually doing the work. Regardless of the fact that there's not an actual patient there, you could simulate it with gurneys or wheelchairs where you wheel them in from the parking lot or wherever your transport is going to drop them off, things like that. It's going to be participating on your computer system where you're connecting to your ReadyNet and things like that. So in this particular exercise, there's not going to be a ton of stuff, but the stuff that you want to do is actually doing the work or walking through the work as if it was actually happening. And so that's the kind of the difference between the tabletop exercise versus the functional exercise. And I'll get into that more, and specifically about the objectives that we have picked for this Mercy exercise. And we'll talk about that during the webinar. And I'll be the one doing the presentation. Our component, so the participant webinar is actually 3 hours long in the morning. We will have kind of a broad overview of exercises and things of that nature by the county. And then we'll have individual breakout sessions for our sector. So for long-term care, we'll do our stuff specific, and that will be between 10:30 and 11:30 during that participant webinar. And then at the end, after everything's all done, then we have what's called an exercise evaluation webinar, where we would talk about how to create your after action report and improvement plan. And that is how you make exercises the true exercise. And so it's great we participate, but if we're not capturing lessons learned and best practices, then things go by the wayside. So what we want to do is, after we exercise, we're going to sit down and we're going to have a group of folks that participate in the exercise give feedback on what we think went well, what didn't go so well, and what are the things that we would like to change in the future based on the things that didn't go well. And so we'll talk about that in the evaluation webinar, and how to do an after action report and improvement plan. And that's the most impactful thing from an exercise. And then this, to my knowledge, it's the last functional / community-based exercise that's available to us for 2023. And so for this calendar year, I'm not aware of anything else that will be available from a community setting that would fit your regulatory requirements. So hopefully I've encouraged you and given you enough information to participate in the Mercy. And then all of the objectives in the handouts and things like that can be found at that link there, as well as links to the agenda, the registration, all of that good stuff can be found there. All right. So I want to turn it over to BK, and maybe BK, could you and BK's our long-term care program manager for LA County, and he's going to talk about a new coalition website, and I'm very excited because this is a website that we encourage you to give us feedback on, so that we can build it exactly how you want it. And so we have a SNF sector page in here that's going to be just for you guys, whether it be links or resources or tools or templates. We need to know how you want us to build it. It's great I have a website that's specific, that's open and broad for everybody in the public, but what we want to do is make it impactful for those in Los Angeles County with Los Angeles County specific information. So BK, do you want to give us a kind of a intro into how you guys came to do this and what's on the website?
Hi, thanks, Jason. Hi, everyone. Sure thing. So the vision was to have a website specific for the disaster services section here at the LA County EMS agency. For those of you who don't know, this agency is composed of many different sections, which help facilitate emergency medical services throughout the county. So the disaster services section is just one of many sections here at the agency. So the unique thing about our section is that we are federal funded. So all of our funds that we receive for the disaster section come from the U.S. Department of Health and Human Services, subdivision of, it's the overall umbrella of ASPR, which is the assistant. Oh no, actually they changed their acronym. Sorry, it's the Administration for Strategic Preparedness and Response. So that's ASPR. So the Healthcare Coalition is mainly comprised of 4 different sectors, which are, hospitals, Emergency Medical Services Agency, public health departments, and the Emergency Management Organization, which is the EMS agency. And we help many sectors, whether it be dialysis, home health hospice, hospitals, long-term care, kind of bring them together and provide resources and information to help them for any sort of like disaster preparedness response aspect. So with that being said, given all the sectors we deal with, me particular, one of my sectors is long-term care, mainly the SNFs. So there's a page that we built. So the website, it's called the Los Angeles County Healthcare Coalition website. So is there a way, Jason, I could put the link in the chat? Is that possible?
I've got it up here on the screen,
Okay,
but they should be good to go. So I've got the
gotcha.
main link, I've got the resources page, and I've got
There you
the
go.
skilled nursing facilities sector page. And I just want to encourage folks, either you can put it in the chat here or reach out to me. I'll have my email address on the last slide.
Okay.
Please give us BK and me, give us feedback on what kind of things you would like to see in there, because we've created things specific for LA County that we're going
Yeah.
to put on there in terms of the surge guide and things like that I think you guys should have. We've got one that's more like a flip chart that you can keep at like nurses stations and things like that, which is really good for staff that doesn't necessarily go through this training all the time. If they have a quick checklist, for specific types of disasters with the contact information for the county on it. Those are the things like that for the LA County that's already been created that we're going to put on that webpage. If there's more things that you'd like to see that will help you either respond during disasters or information on planning for disasters, reach out to either one of us, because we're happy to either create it if we haven't created it, or we can take what we've created and do it specifically for LA County. So it just requires you guys to give us a little feedback, and we're happy to build upon what's already there.
Great.
Yeah.
Yeah, you're totally right. So all the links are here on the page. The bullet at the bottom, that takes you specifically to the SNF webpage, where you can access resource links, resource documents. There's contact information there. And as Jason was saying, if there's any sort of information that you feel that should be relevant, that can address, that's beneficial to the sector as a whole, we could put that on the webpage for everyone to have access to. And videos, PowerPoints, pretty much anything. And as long as it's, the main goal is to have it be disaster preparedness related. So as long as it meets that criteria, then we can put that on our website.
Fantastic.
And again, if you have any feedback or have questions, all my contact information is there on the website as well under contacts. And then there's also a feedback button. If you click that, that generates an email specifically directly to me, where I can respond and take in your questions or comments or concerns.
Well, thanks very much, man. It's very exciting for me and for us because I think LA County we have the opportunity. There's so many things we develop uh, that are unique to LA County that it's important that you guys have opportunity to go get that information. All right, so I wanted to, this has been a very unique, I'll say unique start to our kind of fire season. We have had a very kind of and a portion of that is obviously has to do with our wet winter, but we've had some odd, kind of weather in the last few months. At least since the last time we met, we had a tropical storm. What the heck, in Southern California, as well as an earthquake at the same time. Luckily for us, I did not get any reports of any kind of negative effects at individual facilities. We did get some feedback that we had a lot of folks call off work because their kids were out of school, and so there were staffing issues. But in terms of actual impact from the storm or the earthquake, we did not hear of anything of substance that we would want to pass along. So that being said, this time of year is generally where we're worried about wildfire smoke, and even if we're in a very urban area in Los Angeles County, for the most part, we do have areas which are high fire risk areas. And when that happens and the wind changes or shifts direction, or we get a Santa Ana with a fire burning, many of our urban areas are going to be, inundated with wildfire smoke. That being said, the California Department of Public Health has created considerations for public health officials. It's a big, long, lengthy document. I'm not sure that you really want to necessarily read the entire thing, but there were some really good kind of practical applications of what you can do easily to kind of minimize wildfire smoke, especially for indoor air pollution. With COVID, or any airborne infectious disease, we encourage folks to open up their fresh air intakes on their HVAC systems so that you're kind of diluting the air to the extent possible in the building when you potentially have an outbreak. And so that kind of guidance is the exact opposite of what we would want to do in the case of wildfire smoke. And so it's important that your maintenance staff kind of understand the differences and how fresh air can be utilized to kind of minimize transmission within the facility, but also be shut down to minimize the risk from air pollution actually coming in the building. And so we have created a number of training videos that are available for new or somewhat inexperienced maintenance staff so that they understand some of these kind of risks that the built environment can play in either minimizing or creating an unsafe condition, which could potentially cause activation of our emergency operations plan, or it may be in conjunction with activation of our emergency operations plan. So training videos we have mold, Legionella, HVAC, water incursion, and airborne infection isolation rooms. We have wildfire smoke as well. All those videos, as well as the recordings that we do for these, can be found on our YouTube page. And if we can find a way to kind of build it into that coalition website, maybe we'll do I don't know if a video can be embedded on that or not, or whether we can link to it. But in any case, if you can't find it, you can go to the CAF TV on our YouTube.
We can, Jason, we can embed videos.
Oh, okay, perfect. All right, and so I mentioned ReadyNet earlier in this webinar when we were talking about participation with the Mercy exercise. And so if you're never, or you don't remember getting signed up for ReadyNet, there's kind of like a twofold thing in order to get signed up for ReadyNet. One, you need to sign the software license agreement. So you got to do that first. But after you do that, you can either get training from ReadyNet, you can participate in the bi-monthly trainings that ReadyNet does. ReadyNet also has the ability to schedule training specific to your facility. And they have a ton of training videos and user guides that are available online to kind of walk you through the process. When I want to encourage you guys, this is so important, because In a disaster, this is our primary means of communication. And if let's say HFID, or the Health Facilities Infection Inspection Division, when they come out to do your survey, if you're not answering ReadyNet as the primary way you communicate with the county during a disaster, the chances are you could probably get a deficiency for that, because this, CMS requires that we have primary and alternate means of communicating with the county. If we don't have ReadyNet as a primary means, that's a pretty good indicator to the surveyor that you don't have a good communication plan with the county. And so if I'm a surveyor, that's one of the first things I'm looking at, is how are you going to call for help and how are you going to respond to provide assistance if necessary. And those are the two critical things in a disaster. And so if I'm a surveyor, that's one of the first things I'm looking at. Now, I'm not training the surveyors, but I think an astute surveyor will at least want to see that you have the ability to communicate through ReadyNet with the county. So that being said, there's opportunities galore here to both get set up with ReadyNet and to get trained on how to use it. And that way, on November 16th, when you get the email, you can go onto your ReadyNet, or you can open up your ReadyNet, prior to the actual exercise. And then when it happens, you take 30 seconds and enter that information, and you go, oh my gosh, how easy can that be? That's not that difficult, right? I think the hard part is, one, we don't use it that often, and the only time we use it is during drills or actual emergencies. And so we kind of fall out of practice with those things. And so we've got to get back into the habit of making sure we can communicate through ReadyNet for all of our needs during a disaster. All right, let's talk about upcoming training and webinars. If you're a CAF member, obviously the CAF annual conference is coming up November 12th through the 15th. On November 12th, which is the opening day of the session, which is a Sunday, I will be doing a 3-hour in-person class with a number of different other speakers. So we'll have industrial hygienists, risk management, fire and life safety, emergency preparedness, and we're going to cover a multitude of different topics. But if you're going to come to the conference, my suggestion, especially if you have if emergency preparedness or life safety falls into your purview at your facility, then if you can attend that session on the first day, that'll be a great session. Or we've got, like I said, a multitude of different speakers. It's not just I think I'm going to talk for like 20 minutes and then turn it over to the other folks that we have speaking. So be a great session. Hopefully you can join us. It is available to non-members. If you're not a member of CAF, you certainly can come to the conference, but I do think the price is a little more expensive for those of you that are non-members. All right. In terms of training webinars that were either recorded or are coming up, AB 2511, if you're not familiar with that, that's a 96-hour fuel storage and safe temperature requirement for skilled nursing facilities. And so these this is got a fast approaching deadline. And so it's a 2-stage process. It requires submitting an assessment of a plan to HCI/OSHPON, and you're going to submit this kind of plan to them. And then once they approve that plan, then you'll begin on constructing whatever it is that you put into your plan to be compliant. And I could go on for a long time to discuss the requirements. This will be what I'm covering during the annual conference, but I've already recorded an hour-long webinar on this specifically, and that is available for free. You don't have to be a CAF member, but you do have to go onto the CAF website in order to view it. If you've not signed up for an account with CAF, you certainly can. It doesn't cost any money. You're just going to put in your name and your email address and the company you work for. They'll send you a link to register. You register, and then you can access the on-demand course catalog. Not every class is free on our course catalog, but the ones that I record for emergency preparedness and disaster preparedness are all free. So those Those ones are free and available. And if you're interested, they come with a continuing education credit for that particular class, has an hour CE attached to it as well. So that's available right now. You can go onto the website and just log in and you can access that information. In terms of Nursing Home Incident Command System, we have recorded versions of Nursing Home Incident Command System, but I want to encourage you to join me or have some of your staff that have never gone through a NICS class join me on October 12th from 9 to 12. Once again, this is a free class. It's offered by Los Angeles County EMS Agency. And what we'll do is we'll spend 3 hours, kind of an introduction to the Incident Command System, how NICS is different from ICS. We'll talk about objective setting during disasters, leadership during disasters, things like that, and how to stratify risk, for those of you that will be incident commanders. And then the big news, or the real excitement, is Really Ready 24. Really Ready is a 2-day disaster preparedness conference specific to long-term care. This is unfortunately, it's a big conference, so I have to actually charge a fee to attend. It's not very much for a 2-day class, and it does include food and things like that. So hopefully it's meant to work out to be a wash, and we're not trying to make any money, but we do have to charge a small fee for the class. That being said, information is available now. You can go ahead and register. It will be at the Hilton Irvine, April 10th and 11th in 2024. We don't have an agenda set, but we do anticipate having Chris Sandoval, who works for the LA County EMS Agency, help us do one of the exercises that we do at the event. And so hopefully we'll get a chance to practice some of our plans for safe temperatures and loss of power and things like that, and 96 hours of fuel storage. We plan to kind of practice whether we'd be compliant during the actual conference. So hopefully you have a chance to attend that. And generally, this is a fairly well-attended conference. I don't know that we'll sell out, but generally we get about 300 people, and we've capped the event at 300 people this year. I don't know how many people are registered so far, but more than welcome to go register now if you want to. All right, we talk about, or we don't necessarily talk about this very often, but a lot of people choose to use the Great Shakeout and turn that into either a tabletop exercise or a functional exercise. And especially if you're looking at the Mercy exercise and you go, those objectives that they've laid out in the exercise are not the ones that I would most likely or most want to practice. If that's the case and you want to practice something else, you certainly can. You can create a tabletop, or you can create a functional exercise based on the Great Shakeout. And there's a number of different kind of tools that have been developed, as well as some kind of education on how to create a tabletop exercise for the Great Shakeout and how to do a functional exercise. And while I sit on the committee for the Great Shakeout, I did not create the educational material, but I have watched the educational material. And if you're new to creating exercises, I think it's a good kind of starter to making a shakeout based exercise and making it for your facility. Like I said, if you do that at your facility, the website will kind of walk you through how to do that, but 2, you'll need to create kind of documents, and those are the documents that we create for the Mercy. You will now need to create those same kind of companion documents if you're going to do a Great Shakeout based exercise. And those companion documents are what you'll use to demonstrate compliance during survey time. And so if you're interested in participating in the Great Shakeout, I encourage you to participate anyways, even if it's just to do drop, cover, and hold. The Great Shakeout is held October 19th at 10:19 a.m. That's the time it is every year. And so you can kind of plan around that. Will be next month. All right, I think I have reached the end of my slides, and we got about 5 minutes left. I'm gonna see if I can get to the questions we've got in the chat box. And then And my contact information is here. Certainly reach out to me if you have any questions. Let's see if I can figure out how to get to the chat button here. All right. Chat button questions. Oh, so the only person that put anything in the chat was BK, and he put his a copy of the a link to the exercise drills on ReadyNet. Okay, and I will add that to. Let's see here if I can add that. And I'm not sure if you guys can see a copy of this, but let's see. Yeah. Oh, here we go. Maybe I can send this link to everybody. All right. Well, if I have no other questions, I want to thank BK for his time for joining us, and please I encourage you to reach out to the folks at the DRCs. If you're not getting, if the folks at the DRCs, when you ask them to get put on your listserv, I've had this happen a couple of times. If you don't get a response back from them, be patient. I think those folks have a pretty their plate's pretty full, but let me know so that I can connect with the DRC coordinator and make sure that they've got your information and they get you on the list. So just reach out to me if you're not getting good feedback from them. So thank you very much, everybody. Hopefully you enjoy the rest of your week, and we will see you very soon. Take care. Bye-bye.
Thanks.